So let's go ahead and get started. Again, I'm Paul Harden with Texas Food and Fuel Association, and thank you to members who are on this call. Obviously, healthcare premiums are really out of control. I know for staff, for TFFA it was, and we've been working with this group of folks that you're about to meet, and I'm going to let them self-introduce for a couple of years now, trying to put the plan together and make everything happen. TFFA itself, as staff, we went on the plan enrolled and started in January actually of this past year. We wanted to make sure that something that we put our name to, the TFFA brand to, that it is a good quality product or a service or whatever it may be. You can count on one hand literally the number of companies that we quote endorse or have as recommended vendors, because we're extremely selective about that, and we don't want to put our name to a product or service that isn't going to serve you well or save you money or what have you. So we've been, as staff, on this plan, checking it out, making sure, dotting all the I's, crossing all the T's, making sure the telemedicine actually works, and the prescriptions really are in some cases $1 or sometimes less even. It's been crazy. Our premiums, when we went with this group, dropped 31%. So I don't know if any of you have your numbers handy, and I'm not asking you to yell them out, but let's just say you were to get a 30% discount or reduction in your monthly premiums for your healthcare. What is that like on your bottom line? And I think that's, for us as TFFA, being especially a nonprofit, we watch every dollar. You know, membership dues are a big part of that, and we don't want to be irresponsible with it. So we felt like, you know, that was a tremendous savings, but we also stepped up in plans. We have what we refer to as a Cadillac of plans. We have a $1,000 deductible. A lot of our staff have gone through the, I forget what you call it, but there's ways in there that you can earn even more off your deductible. Some of them have got it down to under $500 for their annual deductible. It's just amazing. And there's so many benefits to it. Folks have been using the telehealth, telemedicine. It's zero copay. It doesn't cost $1. It's pretty amazing. So there's several plans. These guys will talk to you about those. And most recently, they've bolstered their relationship with Cigna and are getting some amazing rates with a nationally known brand. The one that TFFA is on is called Medova, when most people haven't heard of it, but it runs off the backbone basically of one of the largest network provider systems in the country. So we've had zero issues with, even on in our field, we call branded and unbranded. We're on an unbranded plan, and yet we still are able to see all the physicians that we normally would, and they're in network and all of that good stuff. So I'm going to turn it over to these fine folks and let them self-introduce. But thank you for being on this. We're going to record this. We'll have it available on demand as well if there's something you miss or want to play it for others. But please give it a consideration. This is, again, something we've put our name to because we've tested it. It's the real deal. It's not like anything you've ever seen, and it's gonna get really big, and we're very excited to have our name associated with it. So thanks for being here, and I'll turn it over to Fred, Bobby, Janet, and whoever else. You're currently muted. There you go.
All right, thank you, Paul. Just quick introductions here. We're Davidson Insurance Services. I'm Fred Myron, Captive Manager. This is Janet Jennings. She's Chief of Staff. And on my far left is Bobby Davidson. He's the owner of Davidson Insurance Services. Together, the three of us put together these association plans that TFFA is enjoying now. And you might have seen some of our pieces, but you can get the full picture in these two brochures. If you don't have them, we'll make sure to email them out to you. And Paul talked a little bit about the PHCS Medova plan, which is one of the brochures, and the other one is the ABA plan, where we have block underwriting. And when you thumb through here, each one of those has 5 distinct plan designs, ranging from a Cadillac to a high deductible HSA health savings account plan. And the magic of these plans is that in the background, the high claims are aggregated across a captive with lots of other associations. And when you do that, you can spread the risk over a larger group. And the reason we're not a MIWA or an AHP is because each group gets their own stop loss contract, which is the preferred way to administer health benefits in the United States and keeps it from being a political football. So it's very stable. It's run like this for years. The rates, as Paul mentioned, are 10 to 40% below market. Renewals are 3 to 5%. About half of our groups had a rate pass. And that's kind of how it works. The quoting process is very simple. We have contact information on the back of the brochures. It's on your website as well. And now to talk a little bit more about the plans and some of the voluntary is Janet Jennings.
Hi, thank you all for joining us. Like Fred said, we're excited to be able to offer these plans to TFFA members. There are 5 plan options for the medical coverage. They're a little different when comparing Medova to the ABA Cigna plans. There is a wellness benefit associated with Medova, as Paul mentioned, that you're able to in the first 2 months of signing up with Medova. If you jump online, do a health risk assessment, and then have some lab work done, it will actually give you a $500 credit towards your deductible the first year for yourself and your spouse. The Medova plans do have telemedicine at 0 cost. They also have international mail order. So if you have some name brand drugs that are maybe a maintenance drug for you, and they're on our list, you can request those. It's not required, but you can request those from an international company. There's 4 tier 1 companies that we use. The first one is Canada, Australia, New Zealand, and the UK. Thank you, Bobby. I always forget that last one. But the UK, so those are a 90-day supply for 0 cost. So there is a lot of special benefits in here for the members, a lot of cost-saving features as well. Diabetic supplies are covered at 100% on the PPO plans. There are 3 PPO plans, 2 HSA compatible or high deductible health plans. And based on the size of your group, that kind of depicts how many plans you can offer. If you're 5 to 10, you can offer one of our plans. If you're 10 to 20, you can offer 2. And then if you're above 20, you can actually offer 3 plans to your employees. You also are able to enjoy in our national savings with Unum and Principles. So dental, vision, life, disability, those may have a 10-person limit on the life and disability. We also offer a concierge service, which is incredible. What kind of a one-stop place to go for customer service. Maybe you have an MRI, CAT scan, something like that you need pricing on. Believe it or not, the pricing is different at every provider that you go to for those kind of things. And so the concierge service will help you through that, offer up some suggestions, and you get to pick along with your doctor which provider that you use for that. Maybe you had surgery, maybe you had a big claim and you're getting bills from everywhere. Those, the same concierge service will actually review the bills for you if you send them to them, negotiate payments for you, negotiate prices, make sure they were billed correctly. There is even an employee assistance program telephonically on there for your employees as well. So we definitely pride ourselves in offering you national rates for both medical and your ancillary coverages.
Great. So that's a little bit more about the plans. Bob is going to talk a little bit about our robust tech system where all of these benefits are bundled.
Well, first and foremost, I wanted to say that this is a plan that you could come into, and it's a national-based plan that you're going to be able to save a lot of dollars. If you did it on your own, there's no way that you guys could come in and save the kind of dollars that we have. So give it a try. I can't tell you, I mean, Janet's just described the benefits. I want you guys to give it a try because you're basically like an American Airlines employee now. Coming in under TFFA, American Airlines has several 100,000 employees. A 10 life, 20 life, 100 life group can't get these kind of benefits at these rates. So enjoy the benefits, come in, Like Fred said, we've got a high-tech based bin admin system that you guys will just freak out over. Got a little wizard that will guide you through and describe the different benefits and actually select the plan for you. So,
Paul, was there any way we could run that demo right now? Would you care if we did?
Absolutely not. I think that'd be great. And, you know, I should have also thrown out some of the ground rules and I didn't. I think folks that are on this call, the nature of it, you can tell is a little, I'll say informal. So jump in with questions anytime. Certainly at the end, we'll have a little time for Q&A, but if there's something that pops up along the line, unmute yourself and just jump right in, please. Now, do you have control of that, or I think William has to?
We're trying.
Everyone, they should be able to screen share already, Paul.
Okay. William, do you have any Jeopardy theme music you can play?
Da, 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 da. Are y'all having difficulty screen sharing?
No, we're just
Nope, just clicking the buttons and finding the link.
we just want to make sure that everybody can hear the sound at the same time.
Here we go.
Here we are, open enrollment. This is your opportunity to enroll in benefits and get the coverage you need for the upcoming plan year. During this time, you can log in as many times as you need to make changes and updates. After open enrollment, this will be your home for all things related to benefits. You can come here to review your coverage at any time, do things like update a beneficiary, or make changes should you have a qualifying life event. After this video, you will find your available plans in a box similar to this that will be effective on this date.
The Benefits Guru is a decision support tool designed to help you get the most out of your insurance choices in just a few simple steps. First, tell us which family members you are planning on covering. Next, assign a health grade to each covered member. Select excellent, moderate, or poor health. Finally, indicate whether you or your spouse use tobacco and click Continue to submit your answers. Based on your answers, the Benefits Guru will show you the coverage options available to you and rank the plans that may be the best fit for you and your family.
This plan offered is a PPO, or Preferred Provider Organization. So how does a PPO plan work? When you enroll in a PPO plan, you'll have access to a large network of doctors, hospitals, lab facilities, and other providers. When using providers that are in your plan's network, you'll receive the lowest cost for services. This is because they'll be covered at a higher benefit level than any care you might get from a provider that is out of network. While you might be
What is co-insurance? Co-insurance is you and the insurance company sharing in the cost for services. You pay your share and they pay their share. Co-insurance. Let's go into a little more detail on how this works. Here's an example of a medical plan that has co-insurance that is split 80-20. 80% paid by the insurance company and 20% paid by you.
Your employer is offering a special new plan called the Benefits Enhancer Bundle. We call it that because it enhances your coverage for a broad range of possible health events. It's a state-of-the-art program that gives you lots of flexibility.
So it showed little snippets of the things that are in there, but what we really like about this proprietary enrollment system is that it'll answer any question for any employee who's going through it. You heard it talk about PPO and co-insurance. All those kinds of things can be confusing or new for employees. Inside of the system, there's those videos and tutorials. They don't come up unless they click on them. So if they have questions, they can listen to all those things. And it's intuitive with the benefits guru. Normally, you wouldn't see a system like this unless a group was 1,000 or more. And we have it for groups down to 5 inside of this platform. And it's really been helpful for employees. Very few questions coming out of it. Lots of high praise for how that system works and how easy it was. And they can go back in there as often as they want to and revisit what they've done or make life changes inside of that system. And so all of that comes with this program with the deep discounts that Paul mentioned.
Normally, this plan was designed and has always worked for only for thousands of employees to come in, like one group that has 5,000 employees on it. And they've only offered that before for that arrangement. And we got it now to where they'll do this for a 5 life group, 20 life group, 100 life group, where those groups would never have had access to these. We got involved with them, and it took us about 6 or 7 months to build our platform. And we're real excited about it because, again, you don't need to be a 5,000 life group to get this based on this national plan that we've come up for you.
It even actually sends EDI file feeds to the carriers on your behalf. So if you use it to maintain your new hires and terminations throughout the year, those changes are automatically on a weekly basis transmitted to the carrier. So no need in small group world, that's almost unheard of where you have someone, if you're outside of a payroll system, have a system that actually will do that for you. The carriers just don't allow it, but we've set it up with our carriers where if you make the changes in the TBX system, that's the only place you have to make the changes. It'll automatically send those to the providers on your behalf.
Even if you have 3 or 4 or 5 different lines of coverage, it's
Right.
one change, and it changes it for all the carriers. It's super convenient.
I think it's also important to say that you guys will all get discounts that you couldn't get anywhere else. We've built a platform that there's nothing like in the entire nation. We actually have something nobody else has, which is unusual for you guys to run across. We've got deeper discounts. You're going to be treated, if you're a 25 life group, you're going to be treated as if you're a 1,000 life group. And unfortunately, your broker couldn't go out and get you these type of things. This is because TFFA is brought this into the association on this large platform. So that's the reason you're able to get the 10 to 40% discounts.
Before we go any further, are there any questions out there we can address right now?
This really isn't planted, but I've had a lot of members ask me, and you guys can address it. You mentioned the group buying power and so forth. Well, what does it cost to get in that group?
What does it cost to start getting benefits to us?
Yeah, I mean, how much do they have to put down, invest?
Absolutely nothing. And that's one of the hallmarks of the large programs. So a lot of times when you enter a captive plan, you have to capitalize your way in or put up fronting collateral. And then throughout the plan year, there might be a cash call if it's running hot on claims. And then if you want to go at the end of the plan year, there can be terminal liability you have to pay. None of that is part of this program.
These are purely already capitalized. All you owe is your premium, your first month's premium through 12-month premium. You leave the plan, you owe nothing else. That's guaranteed.
And that's a good point. So how this plan works is just like a fully insured plan for you. You get a quote, you're 30% or so below for comparable plans. You decide to go with it. You just pay your monthly premiums. If you want to get out at the end of the plan year, which nobody does, but if you did, you just go get your quotes and move to the next company. So it's just, we intentionally designed it to be that way so that it's non-invasive and turnkey and very easy for groups.
So I have a quick question. You said you have 5 plan designs. So our company is currently with Blue Cross Blue Shield. and we have a PPO plan, we offer 3 different levels to our employees. So they have an option of a higher deductible or a lower deductible. How does that work with your plan? Do you have, does the company sign up with one, so Cigna or whatever the other ones were called, and then you have tiers from that? How does that work with your plan?
Let me ask Leanne, how many employees do you have?
13.
Okay, so you could, with our program, you can have 2 different plan designs.
Okay.
And the plan designs are very similar to what you have today with Blue Cross. You know, for example, you might have a 5,000 deductible and a 3,000 deductible, but we have that too. The only thing that would change is the network. If you wanted a national network like Blue Cross, we have a Cigna program. It's 99% overlap with Blue Cross. You might want to look at the PHCS network, which is the largest network in the country. That's sometimes those plans are a little less expensive, but we would show you both. And so I guess the short answer to your question is it would work like it does now for you.
Okay, so if we wanted to get a quote, then we would just gather the necessary information and work with you to see what would be closest to what we have now. I think, because we wouldn't want to make a huge change for our employees, because as we all see, that's kind of crazy for them.
Yeah.
Well, you know, and just like what Paul just said, when we went through this with Paul in the winter time before COVID hit, I believe, the best of my knowledge, I think we even took him to a 2,000 better deductible to a $1,000 deductible. So a lot of times we don't only just match what you have in force, we better your plans. So you will have that option and still save you money.
That would be what we would look for, right? Of course, to better the plan and save money. We have a great plan now. I think our lowest deductible, of course, higher premium, is around $250.
So you've got a grandfather plan if you've got a $250 deductible.
Yeah, we've had it for a while.
Gotcha. Okay.
But that being said, if the coverage is better, then it wouldn't hinder us if the deductible had to be around 500. So I think it's worth getting some numbers to you and chatting about what plans would be better for us.
Absolutely. I would guess that you've been on that plan for a long time to still have a $250 deductible that obviously has been grandfathered. You've been with that for a long time, so you've taken a lot of renewals by this time.
Yes, and it goes up every year.
Yeah, I would guess that it has. So I would say that we'd probably be fairly competitive on that your group.
Okay. So I guess that you will give us information who will contact and what you need and all of that, right?
Yes, I mean it's on the back of our brochures, Paul. For the people that are on the phone call, if you could hand that out. Our chief of staff, Janet, she is the initial contact, and she is the one that talks to groups initially, and so that's who you're talking to right here.
Leanne, I'll be happy to help you. I do want you to know one thing that's a little different than what you're used to with Blue Cross on your size group is that our plans, because they are level funded, do require individual underwriting, which means we do ask your employees' health questions to be able to provide a quote. But part of that TBX software that we just showed you is also our house for asking those individual health questions. We send out an email to everyone or a link. They log in using their social and a password, and everything is HIPAA compliant and safe. But once we finalize that, and that automatically gets sent to our underwriters, we don't see it here in the office. We don't even have access to it. So once we do that, then they will be able to offer a quote along with a census that you're providing.
Okay, so I understand that correctly. You send this questionnaire to the employees, and the quote is given to each individual employee or to the company?
No, the quote's given to the company. We just aggregate all of the health information from your employees to our underwriters, and they'll issue one quote. So with Blue Cross right now, you either have a composite rate or you have age banded rates. So composite is tiered. You have employee only rate, employee spouse.
Yes.
So ours are not age banded, ours are tiered. So we will come back with a rate for each one of those tiers and each one of the plans that we offer, and then you get to select from there.
Okay.
Leanne, if it makes you feel any better, it takes employees on average, I think we've averaged it out about 2 minutes a piece to fill this out. As you just witnessed, it's kind of a fun thing to do with our little guru on there, the little wizard that goes through there. So it's not a bad thing for them. It's actually a fun thing for them. And again, if they're willing to take a couple of minutes a piece for your 13 employees, I think they'd find it not that difficult.
Perfect. Thank you.
So we have a question on the chat side about pre-existing conditions. All of our plans are fully compliant ACA, DO.
Uh-oh, lost you.
You still hear us?
There you are.
Okay. So all of our plans are fully compliant, and we do not look at pre-existing conditions. That's against the ACA. That's interesting. And also on the chat band, you can see 2 ways. You can see a way to get our brochure from the TFFA health website, and we also have Janet's contact information there.
Yes, and please feel free in this format to please, either type or ask us a question while we're here. Ask them. It's easy for us to get right back to you.
Leanne, if you reach out to me, I will have one of our benefit consultants reach out to you. We've assigned Marion Carruthers with TFFA. She's kind of the benefit coordinator for TFFA. We'll have her reach out to you and help you through every step of the process.
Thank you.
I think, Don, I'm not sure that you completely covered that, but I think it's important to know, in the past we had in the beginning, we had one group that there was 5 people and they had 3 AIDS patients in there. We did not take them. There is less than 1% of all companies that we don't take. We provide quotes for most people. If you're a really, really sick, small group, it can affect your rates, but for the most part, if you're an average physician company, we should be competitive for you.
So just to be clear, age, cancer, none of that has any impact on any other questions out there? So most of the healthcare groups in this country renew in the 4th quarter. It's 75% or more. And so for those of you who are in health plans now, as you get your when you get those double increases that you're likely to get.
The 4th quarter is the busiest time of the year for all of us, for all insurance companies. Your renewal, sit on it until before it's time to renew. It's really difficult for us to, especially this time of year, to react quick enough for you. If you would give us a little bit of time, because of the time of year, give us totally a month to get your IHQs done, for us to get the quotes and everything. We'll react very quickly, but when we're given a couple of days, it's pretty difficult.
Fred and Bobby and Janet, unfortunately, it seems like you're having some bandwidth issues and kind of cutting in and out. And then it popped up with a message saying low bandwidth on
We've been having internet problems since early this morning, so we apologize for that.
We thought everything was completely fixed.
It happened.
Uh-oh, there he goes.
More questions? I know that early on, you guys kind of, I heard, and I don't know if everyone else heard, talking about renewals, on 3 to 5%. I think that's a huge selling point that maybe we should pay a little more attention to here, just because a lot of times, yeah, you can get into some new insurance plan, whatever it may be, at some really good rates, undercut, and then all of a sudden, well, you got hit with a 26% increase or a 14% increase the next year. And that's not the case with what you guys have averaged over the last, 5 years?
I would say probably in the last 4 or 5 months, at least 50%, hopefully you guys hear me, at least 50% of ours are probably more like between a pass and 3%, if you want to know the truth, Paul. I think with the last 5, we've gotten it all in passes. So we've seen very, very, very low renewal rates. So just like you just brought up, Paul, if you guys can hear me, if you come in at these low rates, say if we're able to save you 20 or 30%, and we're able to give you these low renewals like we've been experiencing, you should stay on the plan. You've got an opportunity to stay on this plan for 5 to 10 years. I mean, there's really no reason to go back, because we'll keep you below market for a long time.
Got to be some questions out there. Maybe it's just that simple. Everybody's sold and says, sign me up, and they're going to contact you and save like we did. And, we kind of advertise 10 to 40% on these plans, the savings off your monthly premiums. And again, this is no guarantee, but with some of the things that they've been able to do lately, they have had some over 40% savings, and they're not going to guarantee you that, and they don't even like me saying that, but that can happen. So, again, we had a, how do I word it without, incriminating anything, but our employee pool probably was a little more on the higher renewal side, and again, these guys came in even with what we have and got us a 31% decrease. So I was floored, and I was expecting maybe a shoddy plan, shoddy service, this, that, and the other, and it's just been complete opposite. It's been phenomenal for our staff, and just a great plan, and the service behind it. And if you have a problem, you can actually call, and I'm going to point to one of these 3 people sitting there in that room, and actually reach out and contact them, and they will fix anything, but I doubt you'll have any reason to.
So part of what's wrong.
I feel like I'm the only one who has any questions. Sorry.
Oh, yeah.
But we have a renewal date in April. So how would that affect it if we wanted to start the plan in January? What would the process be, and how would that affect our current insurance?
You said you're with Blue Cross, fully insured right now?
Correct.
So interesting on those contracts, that's they've contracted with you for 1 year, but you have not contracted with them for a year. So with those plans, you're 30 days and out any time of year that you want to. So if you wanted to take a look now and see, and we saved you 30% and you wanted to move, you just give notice to Blue Cross and set your effective date, and you could be with us on October 1st.
Oh, okay. So you only have to give them a 30-day notice then?
That's exactly right.
Well, that makes sense, because we pay our premiums a month in advance. So.
Right.
So if you're looking for a January 1, Leanne, the underwriting data, usually the underwriters like for it to be within a 60-day window. So if you're looking for January 1, we probably want to start mid-September to late September answering those health questions. So all that data is still good for the underwriters, and should it be positive, which we certainly would hope it is, you could go live January 1. We still want to start too early and then have to go back to the employees and ask them, hey, has anything changed?
Or if you wanted to start November 1st,
right,
we could start in the next 2 weeks
right,
with you, and bring you in possibly October 1st or November 1st.
Right.
That would be totally up to you, but it would be fresh live data. So
Right.
it's really up to you if you want to save the money and have equal to, if not better benefits, then that's totally up to you. It depends if you want to pay more for the exact same thing.
Okay,
That's what I like to tell people.
gotcha.
And that goes for everyone else on the call as well, unless you're in a captive or some extremely unique situation. Almost any carrier out there, you're going to have a 30-day notice. So, you know, personally, if it were me, just like we did, we as soon as we were able to get on the plan, we did. Why would I wait and pay 30-40% more per month for another 6 months when I could start saving that immediately? If you were buying fuel and somebody said, hey, I can get you 5 cents cheaper per gallon, then, you know, well, I've contracted with this guy, but I can get out anytime. Well, you would get out and start buying the cheaper fuel. And anyway, that's kind of my little scenario on that.
Yeah, so someone's asking to talk about deductible carryover. Thank you, Gary, for that. That's very important. So should you decide to leave before January 1, when most of deductibles and out-of-pockets refresh, we honor any deductibles and out-of-pockets that the employee may have already experienced this year. And so typically we'll ask for their last EOB from Blue Cross. If you come in October, we're going to give them credit for any deductible or out-of-pocket that they've met. So that's a great, so it's a no loss situation for you if you wanted to come over early and not have to worry about those deductibles or out-of-pockets.
We've got another question here about how to get a quote. A little further up on the chat screen, you can see Janet's email, janet@davidsoninsservices.com, and then also her phone number. Just send Janet an email or give her a call, and we'll get you started on the process.
There it is.
So I have another question in regards to your deductible carryover. We have the situation, since our renewal date is in April, that our deductibles renew in January.
Right.
How does that work with your plan? If we started, say, in November, when would our deductible renewal be? Would it be November or would it be the calendar year?
It would be calendar year. So we would give you credit for anything this year through the end of December, through December 31st. And then January 1, those would refresh.
Okay.
By the way, Leanne, these are very good questions. We are in this format a lot with other associations, and you're asking some excellent questions.
And we did not pay her for that.
No, never met her before, I promise. And Paul didn't give her those questions, I know.
Well, I know my husband, Wolfgang Mons, is on the board of TFFA. He's going to ask me 1,000 questions, so I'm prepared.
Yes, we will.
Leanne, write my phone number down, because
I got it.
the call and you have any more questions, please feel free to reach out to me.
Yes, ma'am. Thank you.
You're
Yes,
welcome.
and if your husband wants to talk to any of the three of us or all of us, tell him to feel free to.
No, he just makes me do it. I'm sure.
Your husband may have met us, Leanne, if he was at the board meeting out at the ballpark last fall. We spoke to the board.
Yeah, maybe, because I think that's when he came back and threw all this paper at me and said, study this.
Yes, he is the very tall fellow with the accent.
That is him.
If I can jump in just for a quick second for everyone on the call, just as a housekeeping item, when I send out the recording to everyone, I'll make sure and put everyone's contact information in there so you can get a quote, and also attach the brochures that we've been talking about as well for your reference.
Thank you, sir.
You're awesome.
Thank you, William.
So just while we're kind of waiting for another question, you know, I keep harping on the money savings here, but you know, I've got to point out again that it's an incredible plan that really also benefits your employees. I mean, they're going to have lower out-of-pocket costs. The prescription plans are amazing. They mentioned the international plan. If you have a regular, let's say it's a blood pressure med and you have a 90-day supply, you do that through the international program, it costs them $0. I know it sounds too good to be true, some of the stuff, but it's like, my gosh.
Well, and just so you know, Paul, for everybody, when we get somebody's information in, for example, Leanne's, if we got her 13 life group in, that's going to go to 3 different TPAs. The plans are almost replicated, so it's not that much difference. But what we want to do is we want to make sure we're obtaining the best price for each person that's coming in. So whichever one fits better, but sometimes they're right on top of each other, and we'll be showing you 2 different quotes or perhaps 3 different quotes. So it's no different than you going out and getting a quote from United, Blue Cross, and Cigna or Aetna. We're going to find the best deal for you within these TPAs. And again, because of our buying power, we've got, several million people now in this thing. We get different rates than everybody else does around the country. And therefore, TFFA gets much lower rates, but that was from the beginning.
So a TPA is a third-party administrator, and in these debundled plans, we're able to control the cost of each part of the healthcare plan. The administration of the plan is conducted by a TPA, a third-party administrator. The same function is carried out with United Healthcare Blue Cross. You just don't refer to it because it's embedded inside the whole system. So I just, Bobby says TPA, we're kind of entrenched in the
I'm sorry,
language.
yeah.
I'm sure you understood what that
But
was.
I would like to give an example, and Janet just went through this right before we got on this phone call. Another association that we've got that's a national one, it's not a Texas one, it's called Brand Source. They gave us a group, about 8-10 days ago, and today Janet just went through the quotes with them. On the ancillaries, we're anywhere from probably 12 to 30% below all of their dental, disability, life, everything that they had.
One was over 40%.
One was over 40%, sorry. On the medical, which I'm sure you guys are interested in, that's what you're here to hear about. On the medical, I think we were at least $300 below on their full family rates. We were well below on their employee only rates. And it was such a, Janet was describing the phone call to me. She had one of our enrollers and herself on with the head of the organization or the group. And they went through it, and it was, they were in total amazement. They're like, how can you be this much lower on everything? And the benefits were even better. So, that's part of the magic that we worked in the background, but it's, it doesn't cost you a dime to take this journey. If you come in and go through the quoting process, hopefully you're not the people that are 5 lives with 3 AIDS patients on there. But, if you're of average health, we should be able to give you a very competitive quote. So, but it doesn't cost you a thing other than the 2 minutes for your employees to take and fill out, and you guys to provide a census to us.
So again, to get a quote, if you guys will reach out to me, the process will be, I will assign it to a benefits consultant. They will then reach out to you, let you know what they need from you. A census will provide a census template, basic information about your employees, about your company, some general information about what plans you currently offer now. And then when they receive that back, they send that to TBX. TBX prepares the IHQ platform. We let you know when that's ready. It gets sent out to your employees. They complete the information. When that's done, usually we allow 5 days for that. Any more than 5 days, just people always wait to the last minute. So we give you more than 5 days. They take more than 5 days. So we're really asked to kind of keep that in your engagement and helping us make that happen, to have the IHQs done in 5 days. Those are submitted to the underwriter, which can take up to 7 days to get a quote back. And then we come back and set up a meeting with you to present our quotes, and you get to make a decision at that time. So there is no obligation at all until you decide to move forward.
And I would like to use an example. Y'all currently have a 200+ life group that just went, it's a TFFA group. I won't name the name of the group, but they're in underwriting right now. We should have written quotes probably by tomorrow for them. But believe it or not, Fred and I got on the phone with him. I won't say his name or they know who it was. We got on the phone with him, and 2 days later, we had 100% of his information. 100%, 2 days later. So that shows you that, Leanne, like your 13 life group, it shouldn't take 5 days. It shouldn't take 2 weeks. We've experienced this early on that, you know, if you just say, okay, just turn it in when you want to, then your employees will wait a month or longer. And Paul knows all about this too. But if you lay some restrictions there, they'll get back in quick and everything works out well. So anyway, I just wanted to give you an example of we've got several of y'all's groups in underwriting right now. And people are responding really quickly. And they can, a large group can respond very quickly.
So another question. Sorry. So
Great question.
So Blue Cross Blue Shield has a stipulation that our rates are contingent upon the fact that we have to, as the employer, contribute 50% of the premium for the employees. Do your plans have that type of restriction?
They do. So we are the same restriction, 50% of the lowest plan offered. So if you're offering 2 plans, you know, maybe a high deductible health plan, which the rate would be lower, just required for 50% of the employee only rate.
Okay.
Okay. So we do ask for at least 75% participation of your group, excluding waivers.
Okay.
So we have the same rules that Blue Cross does, I guess is what I'm trying to say.
So Leanne, I think you'll find out if you didn't cover at least 50%, I think most of the groups that we take care of probably contributed 70 to 100% is more like the average. If you went in and you only paid 30%, you'd probably less than half of your employees might even take the insurance. That's just the world we live in. I mean, employees really want you to pay at least half of it for them to come in.
Yeah, we do. We actually pay more. Just wanted to make sure that that was something that you required as well.
Yes.
Right.
And it's also a safeguard against some provisions of the Affordable Care Act. 2 hallmark pieces of that legislation were minimum essential coverage. What's the minimum amount of things a plan has to have to be a plan? And then minimum value. And so nobody can have to spend more than, is it 10.5%?
Like 9.56.
Yeah.
Yeah.
And so the only way to do that, if you happen to have lower wage employees, is for the employer to contribute at least 50%. And if you don't, then it can end up putting them where it's not a minimum value. If they don't take it, they go out to the exchange, they give that and report it. That can actually be a fine for the employer. Not to get too technical in the Affordable Care Act, but
Yeah, no, that's perfect.
that 50% is actually a savings if you happen to have lower wage employees.
I think it's important for you guys to know that there's several things that are offered here that we're not talking about. We could actually probably talk for 4 hours. And not that you want to hear that from us, but like we provide Think HR, which I think is it's something that you guys would have to pay a lot of money for, that we provide to you for free. And I think, Jen, if you could just talk about the Teledoc and the Think HR just real quick.
The Teledoc I already talked about.
Okay.
So Think HR is a service either online or telephonic that we provide to all of our clients. I have an HR background before I came into the producer and broker world. That's what I did. And I would have died to have had this service available to me, especially free of charge. So you have unlimited access to 50 to 60, 70 SHRM accredited professionals that you can call anytime, during the day. It's not 24 hours, but they have extended hours. Ask them any type of question. Maybe you have a hard termination that you're not quite sure how to handle, or maybe are you discriminating against someone if you handle it in a certain way. We all know that terminations every case is different, but maybe you're trying to create an employee handbook and you need help with that. this company helps you with all those things. We also use the same company for compliance. They will help you through what you need to do as an employer to be compliant. If you do pre-taxing, we do those documents for you for free. Think HR even has a learning system with over 200 courses, a training system with over 200 courses. Maybe you need to train your employees on sexual harassment. You can assign them to go in and actually perform that class online. It gives them a certificate, lets you know when they're done, and it saves the certificate for you for up to 7 years. So it just has a lot of functions, and it's great to be able to pick up the phone and call somebody and give them the specific details about, you know, a certain situation that you need help with. So it takes a lot off having an employer attorney as well.
Well, we are paying for that. You don't have to pay a dime for that, and that's provided for you. Especially if you have a smaller HR department, that would really help you out. The concierge benefits that both Fred and Janet talked about, I think that's important to know. If you were a 10 life employer and you're going to go out and buy these concierge benefits, it would be closer to $16, $17 an employee to get this. I'll just tell you that we don't make a dime off of it, but we have negotiated this on a national contract for a little over $3 an employee. And that's a pretty good benefit. Again, if you look at this whole program, this is, again, I'll bring up the American Airlines type situation. If you've got a 5 life group, 20 life group, 80 life group, you're going to be treated like you've got 100,000 lives. That's what TFFA has put you in the way of. Any other questions from anybody?
We also have, we have a contract or a partnership, not a contract, but a partnership with Ameriflex. Ameriflex is a national COBRA, HSA, FSA administrator. And so they've given us discounted rates below national average. It's also in the brochure. So when you receive the brochure, it'll tell you what they're willing to do for you. You get an independent account manager assigned to you. Online system is great, very user friendly, but they help you keep in compliance with all of those issues as well.
And with those, I'll just say quickly, with those, there's always front end and back end rates and a higher rate. We've gotten a negotiated lower rate for the nation. You don't have to pay any front end or back end rates on that at all. So you can't buy a COBRA administration system cheaper than this.
Yeah. There's no setup fee and there's no renewal fees every year either. So it's a monthly fee, or you can pay an annual fee for a discounted rate as well.
Okay.
Last question, I promise. So what are your waiting periods for new employees? Do you have a mandatory 30-day waiting period, or is it 60, or is that determined by the company ourselves?
It's determined by the company. Each individual company will be able to set their own rules. We do have an option of first of the month after hire date, first of the month after 30 days, and first of the month after 60 days. Do any of those three beat what you currently have?
We currently have 30 days, but you know, sometimes we run into the situation where we want to hire somebody and they want insurance now. They don't want to have to wait. And that's one of the requirements of, you know, I'll work for you if you will let me have insurance from the start date. So
well,
is that something that you can work with?
Yeah. When that happens, I usually suggest that you maybe pay their COBRA benefit for them until they're eligible under your benefits.
Gotcha.
Because you don't want to discriminate. But I know a lot of times employers do what they have to do. We cannot override what you've set up initially. You can change that once a year at renewal if you want to change that rule.
Right.
You
Okay.
can keep it at the 30 days, change it to the 60 days. That's totally up to you.
Okay. Perfect.
Good. Good questions, Leanne.
Yeah,
Yes.
Leanne,
Hey,
we need to hire you.
I was gonna say, I'll send you the bill later.
Yes, please. Please.
Paul,
Anything,
anything else from you?
I was just going to reiterate, I think it was put on the comments, but there's a couple of easy ways to get Janet's information. If you don't see it on there, we'll also email it to you along with the links, but you can always go to tffahealth.com. That's a link that just frankly forwards to the right place on our website. We've tried to make it as easy as possible also on tffa.com. Right under the big COVID-19 graphic, below that is a healthcare graphic for the plans. You click that, takes you right to it. Also under the membership tab up at the top, or menu, if you click on that, one of the drop downs is TFFA health plans. So we've tried to make it as simple as possible, and Janet's info everywhere. So if you, worst case scenario, you just call me, email me, smoke signal, whatever, and I'll get you connected with them. So there's nothing else. One last opportunity for questions, and you can always ask these questions to them directly if you're not comfortable doing it in this environment. We certainly understand that. Just shoot Janet an email or a call, and they'll answer them. But thank you, Fred, Janet, Bobby. Appreciate the time, energy, effort, and being able to partner with you guys is a real pleasure, frankly. I'm excited when we can go to our members and offer something like this that they can't get anywhere else, number one. Number two, it makes them save or helps them save an incredible amount of money. And three, it's just a high quality plan, all of them that you offer. So we're excited. We've personally experienced the plans now for 8 months, and can certainly feel confident in promoting this. So thank you to the members who were on this unique webinar call, whatever. I don't even know what you call this formally, but we called it webinar. But we're grateful for your membership, and just give these guys a shot to give you a quote and see what the savings are. If it's anything that we haven't said, let me know. But otherwise, I think you'll be real pleased and have a better offering for your employees and save a lot of money on your bottom line. So thank you all for attending, and we'll wrap this recording up and send that out to the interwebs and make that available. So thank you all again. Have a great day.
Thank you.
Bye. Thank you.
Take care.
And Leanne, tell